The diagnosis of aortic stenosis is pretty simple provided we perform the echo on a high-end echocardiographic machine. And in addition, we have to do a multi-slice CT angio, 64 slice and above, for identifying the aortic valve morphology. So the diagnosis requires these two tests, and with this we can make a diagnosis. But in case if we do not have a dedicated protocol for performing the echocardiography, or a high-end machine is not available, many of the cases which I encounter in my daily practice, they are missed out diagnosis of the aortic stenosis because they are not geared up to perform a high-end echocardiographic study for an aortic stenosis patient. So in a patient who is elderly and who has got an unexplained breathlessness and who has got a murmur in the heart, I would strongly advise to go to a center where there is a high-end echocardiography and a 3D echo to understand what are the common problems, what are the problem in the heart that is responsible for the breathlessness of this patient. Aortic stenosis is a disease where an early treatment is essential for the survival of the patient. Because there is an obstruction of the outlet of the left ventricle, if there is an increased load on the left ventricle fails. That is what we call as the heart failure in a patient with aortic stenosis. In addition, because of this excessive load on the heart can suddenly stop also. That is what we call as the sudden death. And because there is an obstruction to the blood supply to the various organs of the body, similarly the heart also will not get adequate blood supply, because of which the patient can suffer with chest pain. So people with aortic stenosis can present with chest pain, breathlessness, or they might even die suddenly. The usual survival pattern of a patient with aortic stenosis was or used to be up to 3 to 5 years. But in the current generation, the 2021-22, when we look at the aortic stenosis, this type of aortic stenosis is due to a different problem called as the sclerodegenerative. That means with advanced age, the valve gets degenerated. Most of these patients have got an associated blocks in the heart vessels that is called as the coronary artery disease. In addition, they have got uncontrolled blood pressure, they have got high diabetes, and also other metabolic problems. So those patients who have got these associated problems, the survival is not even for 5 years. Usually the survival is up to 2 to 2.5 years. So that is the reason why we need to get the aortic stenosis treated much earlier. In the past, we used to treat only patients with symptomatic aortic stenosis, but the needle is moving more towards a severe aortic stenosis, even though if they are asymptomatic, if our high-end echocardiography machine can identify subtle changes in the heart structure, that is indicating that there could be an impending damage to the heart.